Well, welcome back to News Channel 13 at 4:30. Thanks for staying with us. I'm Heather Skold.
And I'm Bart Bedsole. Today and throughout this week, we'll have special coverage for you on COVID-19 in Colorado, recovery and relief. It's a special town hall series we've put together to help you stay safe and informed throughout this pandemic as we move into the safer at home phase.
And so many of you have reached out to us, some with questions, others frustrated about the process of reopening the state and restarting the economy. So we brought in the experts to address your more pressing concerns moving forward.
As we practice safe social distancing, our guests will be joining us remotely today. Welcome to you both. They are Dr. Robin Johnson, El Paso County Public Health Director, and also Dr. Bill Plouth, Chief Medical Officer at Penrose St. Francis Health Services. Our first question is for Dr. Johnson. It has to do with the state of the pandemic right now. The question is, where are we right now with regard to COVID-19 cases in El Paso County? Do we have a handle on them, or do we even have enough testing kits right now to really provide an accurate answer to that question?
Yeah, actually, we have really good news for El Paso County. At this time, we have seen a 2-week decline in the number of cases each day, and that has stabilized out. And so we have continued cases, but it is a pretty steady hum of those cases in the background. And in conjunction with that, not only have we seen all of our partners in the community step forward to increase the bandwidth of testing, but they have been working with their labs to assure that there are the machines and the reagent to run those tests in a timely fashion through their labs, so we can get that turnaround in 24 to 48 hours of the results. So if there are positive cases, we have the opportunity to investigate those cases and advise around quarantine and isolation, making sure that we're reaching out to individuals who may have had contact with a positive case. In addition, they're looking at assuring that they have the swabs and the viral medium for the transport of those personal protective equipment and the staff who collect those swabs. And as you know, really early on in this pandemic, we were struggling with both that testing capacity as well as the resources to collect, as well as the PPE to protect our staff that were collecting those. And at this time, we really have the resources that we need, and we continue in communication with those partners to assure that we maintain that sustainably.
Also, Dr. Johnson, some businesses have already started to reopen. There are yet others, like restaurants in Calhan, that have defied the governor's orders, started to reopen, claiming it is their constitutional right. With that said, do you think we're actually ready to reopen?
We are continuing to look at that data. We have an Office of Data Analytics that is plotting out our trending, and we continue to be very timely in that epidemiologic investigation, meaning that we contact the cases early and are intervening through conversations with them with quarantine and isolation. And with that, I do believe that we are poised to begin those strategically and stepwise implementation of opening our economy and continuing to move that forward.
Dr. Johnson, one more question for you, and we'll leave you alone. Heather mentioned that some businesses are choosing to jump the gun, and there have been some letters to cease and desist that have been sent out, although there's a question about whether they've been received. There's a perception that a lot of these businesses continue to operate unpunished, and that suggests that maybe all businesses should open in the same way if nothing is really happening to them. How do you respond to that perception?
We had one cease and desist that was delivered and was complied with after a fairly robust conversation and without any complications. We are working with our legal advisors as well as law enforcement to assure that we have a procedure that would be appropriate if we need to move beyond that cease and desist, that we would have the burden of proof if it needed to go beyond that, and to assure not only the safety of our community, but also the safety of public health staff as we move into this. I do not believe that the impression is that we are not paying attention. We are, but we are trying to do so in a with civil discourse and processes that support what has already been in place legally and that hold us to the highest standard of that kind of legal communication with our community as well.
Okay. Dr. Johnson, thank you so much for your insight. We want to transfer over now to Dr. Bill Plouth with Penrose St. Francis. Thank you again for both joining us. Dr. Plouth, I wanted to ask the difference between ventilators and oxygen, treating those who are really struggling with COVID-19. Originally, we heard everything about ventilators. We need them, we don't have them. And now what I have heard is that people really respond well more to oxygen. The ventilators seem to put too much pressure into the lungs. Is that true? And where do you sit from a PPE sort of standpoint? Do we have enough ventilators?
Yes. So the vast majority of patients with coronavirus who get admitted to the hospital are admitted to the hospital because they need oxygen. And so almost all the patients do get oxygen, and we can deliver oxygen in essentially every room in the hospital. It's only when someone gets sicker that they need higher forms of oxygen, and the ultimate form of oxygen is actually delivered by the ventilators. When the pandemic started, the mantra was intubate early and to put someone on a ventilator very early. What we soon learned is that we changed our practices just for the very point that you made, that sometimes people seem to do better without the ventilator. And so we really try to hold off on putting someone on a ventilator as long as possible. Now, with that said, we may still use the same ventilator, but we don't do all the breathing for the patient. And there are different modes that we can use for that. But we do find that if someone doesn't require the full ventilator, they frequently do better. And we've had a lot of success with that. In regards to ventilators, yes, we are doing well. At the peak of what we saw with the COVID-19, we never got to 50% of our ventilators that we use on a day in and day out measure. And then we had other ventilators that we could rely on. And it's one of the advantages of being part of a large system is that we can also rely on our sister facilities to share ventilators as needed. And currently we're sharing with some others, and we'll get those ventilators back soon because we just have not needed them.
So, Doctor, it sounds like equipment-wise, you're in a pretty good spot. We know staffing-wise, you're pretty good because you've actually sent some workers to help out in other areas harder hit, although we should make it clear you haven't had to lay off or furlough any employees there. So you're okay on staffing, you're okay on equipment. What do you see as your biggest challenge from a medical facility standpoint right now?
I think one of the main ones is just getting back as near to normal operations as possible. Things are definitely not normal. We have adjusted our practices on people coming into the hospital, visitors and the like, to make sure that we're properly screening people so that no one brings coronavirus into the hospital undetected. Right now we have very few people in the hospital with coronavirus, but at the very peak we actually had 4 floors in our hospital closed just because we had that few number of people in the hospital. The other big challenge is making sure that the public is aware that the hospital, if you're sick, please come to the hospital. Let us treat you. Lessons learned across the country is that people with heart disease have been staying at home when they've had chest pain and are suffering from heart attacks at home, or have not followed up on strokes or warning signs of strokes, where had they come to the hospital, we could have treated them and they would have had much better outcomes. So really we're trying to get back to normal as much or as closely as we can, because diseases like coronavirus we do treat very frequently, and for all those other medical conditions, people still need those treatments, and we want them to come here so we can help them.
All Right, Dr. Plouth, Dr. Johnson, thank you again for joining us for this town hall. It goes without saying, the economic impacts of this pandemic have been devastating. Tomorrow, we delve deeper into the effects on the economy here in southern Colorado, what it means for all of us, and why it's going to take time to recover.
So join us tomorrow again here on KRDO News Channel 13 at 4:30 as our COVID-19 in Colorado Recovery and Relief Town Hall continues. More of the day's news and your forecast.